Hi students, back again with another video. This time I want to show you the syllabus and we'll review that together. The syllabus is our contract between you as the student and us as your instructors, Hannah, Ashley, and David, all of us. So I just want to make sure that you're familiar with it and go over all the important parts. So hopefully you already know that on Fridays we will be coming into the lab in smaller groups or partners, just depending on our competencies for the day. The rest of the theory will be online. And our course description is clinical skills utilized in the outpatient medical settings. So you should have all taken midterm already, gotten a grade of C or better to even be in the AMAP program. And of course, it's recommended that you've had English 100, Reading 100, and at least eligible for algebra because of some of the math that is done in the medical assisting courses. So the required textbooks are the Clinical Procedures for Medical Assistants. The authors are Bonawit West, and we are using the 10th edition. And then the corresponding study guide, 10th edition. Okay, as I've mentioned before, the textbook, if you want to get the e-version, the electronic version, that's fine. You can also get a used version of the textbook, that's fine. But the study guide needs to be new, as you will be writing in it and filling it out. We're always going to need black ink pens to do our charting and homework. And it's recommended that you have a watch with a second hand when you're here in the lab and a little notebook to keep notes as far as when you're rooming your patients and taking chief complaints and checking vitals. You're going to want a place to just jot those down until you are able to get to the chart. Okay. Our learning outcomes are to analyze the professional roles and responsibilities and scope of practice of the clinical medical assistant. And we're going to perform and document clinical tasks, procedures, and CLIA-waived lab tests safely and accurately within the scope of practice for a medical assistant. All right, so how are we going to do that? We're going to be taking vital signs, assessing visual acuity, color vision, patient positioning, bandaging and wound care, applying heat and cold therapy, crutch training, assisting in minor office procedures, administering oral and parenteral medications, applying pediatric urine collector, capillary puncturing. We're also going to be performing math conversions and calculations, including pediatric growth percentiles, medication dose calculations, height and weight measurements. We're going to analyze the OSHA standards and make sure that we're performing correct hand washing techniques, aseptic and sterile techniques, application and removal of PPE, including disposable and sterile gloves, collection and handling of lab specimens, autoclaving and sterilization techniques, and appropriate regulated medical waste disposal. We're going to perform CLIA-waived tests, including a urinalysis, urine pregnancy test, blood glucose test, rapid strep test, and fecal occult blood test. We're going to learn how to prepare our patients for tests and procedures by providing accurate information and instructions and using proper documentation of our patient interactions and all clinical procedures performed. We're going to analyze the HIPAA Act and demonstrate patient confidentiality. We're going to do bloodborne pathogen training and also disaster preparedness training. Okay. A lot of these things are pretty standard. You're going to find on probably every single syllabus of every course that you take at Cabrillo College. As far as the non-discrimination and accessibility notice, basically that our school is committed to equal opportunity in all areas as far as educational programs, employment, and all access to programs and activities. So no regard to nation of origin, religion, age, gender, gender identity, gender expression, race or ethnicity, color, medical condition, genetic information, ancestry, sexual orientation, marital status, physical or mental disabilities, pregnancy, military or veteran status. Okay, so basically everybody should have access. And the Accessibility Support Center is available to provide accommodations and help facilitate that for students with disabilities. Okay, so if you have a documented accommodation through the ASC, please provide your instructor with a copy of the accommodations form as soon as possible so that we can make every effort to accommodate your needs. Okay, there's a lot of support services at Cabrillo. Please take advantage of them. Financial aid is available. As far as the building here, the Health and Wellness 2 building, no food is allowed upstairs anywhere. That's for a couple reasons. One is that we're dealing with, testing and specimens and things. And also we have an ant problem. So covered drinks only. Okay. And you really shouldn't actually have the need to eat in the building at all because you're not going to be here all day as in the past due to COVID-19. So please just don't even bring food into the building at all. Eat before you come in for lab or eat after. Okay. You're going to be required to wear your uniform every day that you're here, every time you come onto campus, which I believe will just be on Fridays. And so that'll be your scrubs, whichever color Lori and Ashley provided to you. Okay. If it's cold, you're going to want to get a long sleeve shirt, solid color, to wear underneath your scrub top. But that can be a little problematic when we get into checking vitals and things like that, as far as checking blood pressure. So you can also, hopefully we'll be ordering the AMAP sweatshirts here pretty soon that you can wear over. Okay. You're also going to need to have closed-toed shoes, right? That's an absolute must. No hats or scarves or anything. And hopefully this has been covered already, but when you're in the lab, long hair should be tied back and secured back out of your face so it's not hanging down into what you're doing or on your patient. Okay, it's really important that we maintain good personal hygiene, clean scrubs. Here it is, long hair should be tied back and nails should be kept short and clean. No acrylic nails, anything like that. Those are just breeding grounds for bacteria. Okay. We can't chew gum in class or in the lab. That's basically the same as eating food, right? And no heavily scented perfumes or lotions. A lot of people are sensitive to those, so we need to be mindful of how we smell too, and especially in regards to any cigarette smoke or any other kind of smoke smells as well. Those can definitely exacerbate asthma and other medical conditions, and we want to be mindful of our students as well as our future patients. So the lab class times will be assigned to each student, and you will also have to perform screening for COVID-19. So it's really important that you arrive on time. Everything's going to be very specifically calculated as far as how much time you're allowed in the lab, and then the next group will be arriving after you. So if you're unable to be on time, please let your instructor know as soon as possible via, I think probably a message on Canvas or an email would be fine. And just do your best to be here on time. Okay. Every single lab competency has to be completed 100% to pass the course. So if you're unable to make it into the lab that week, maybe you didn't pass the COVID-19 screening or you're ill with some other affliction, we'll have to make it up before the end of the semester. Okay. So there should be a compelling reason for your absence, and you're expected to be here for the entire duration of your assigned lab time until you complete the competencies for the day. If you have to leave early, there should be a compelling reason as well, but please just talk to us. Okay. So an excused absence is one that is discussed ahead of time with your instructor. So if you know in advance that you can't be in the lab, let us know as soon as possible. An unexcused absence is one in which you would not contact the instructor at all. And then excessive absence defined by Cabrillo College is, it's quite a bit actually, one more than the number of hours a full-term class meets each week during the whole 16-week semester. So that, I don't know exactly what that is, but it's quite a bit. Okay. Personal electronics are not allowed in the class, okay, unless you have some sort of assistive device. Cell phone needs to be placed on silent and put away in your backpack, purse, or bag. Okay, it shouldn't be out. This is really important because it's very distracting and is not the best use of our time while we're here in the lab. Okay. Also, it's reflective of what you're going to find in the workplace. Where I work at Palo Alto Medical Foundation, there's a very strict no cell phone policy. We are not allowed to have them on us while at work or be on them. So it's a good time now to start practicing and kind of break that bond that we have with our smartphones. I know I'm guilty of it too. Okay, if you're expecting an urgent phone call during your class time, let us know. We can always keep an eye on it for you. You know, if you have somebody watching your child or something urgent that you might need to take it during lab, let us know and we'll work something out. Okay. The student code of conduct, read it here. All the acceptable standards. This is Cabrillo wide. Okay, your rights and responsibilities here. Make sure you know those. Okay, all the things that are unacceptable. Hopefully we don't ever have to refer to any of these things. But like I said, this is a contract, so it's here. It's our contract together. Campus safety and security information would be the sheriff's webpage for Cabrillo. Okay. We'll talk a lot about safety here in the lab, especially, but these are more general, right? Coming to class, dress properly and prepared to pay attention, learn and participate, and modeling professional behavior, being respectful of the instructor and your classmates, using appropriate language and making appropriate relevant comments, honoring our confidentiality and privacy. That's really important in here because we'll be, in more different positions than you would be in a normal class. So it's important to respect each other's personal boundaries and exercise sound judgment and critical thinking skills, learn how to practice self-advocacy and self-discipline, and demonstrate integrity, both academic and personal. So that means that we have to be honest, accountable, safe, and discreet, and be honest with homework and exams and do your own work. Okay. There's a description here of examples of disruptive behavior. Hopefully this isn't an issue at all for us either. Okay, but one of them definitely is electronic devices that can be very disruptive to your fellow classmates, and side conversations, getting up and repeatedly leaving the classroom, especially, well, we're not going to be taking our exams in the classroom, so it doesn't really apply here, but working on homework while you're here in the lab. We just need to make the best use of our time while we're here. Okay. There's your consequences for the disruptive behavior. Again, hopefully this isn't something that we have to even refer to. But if it is, then I know what to do, and here it is. Okay, severe clause, such as being under the influence of drugs or alcohol, any racial slurs or type of sexual harassment, physical violence. That's a pretty severe issue that will go to the division dean and the dean of student services. It could mean a drop from the class or even the program. So hopefully that's not something we have to deal with. Okay, we covered the grading policy a little bit already. Okay, we have a higher grading scale for the whole AMAP. It says there's no extra credit, but that might not be true. There may be a few opportunities for extra credit. Okay, academic integrity. This is really important as far as, especially now that we're doing so much work at home or not here at school. So you are expected to study with integrity and honesty. Okay, and that includes doing your homework and your assignments and taking your exams. So it's really important that you don't cheat or help each other out. Okay, if you're caught, it's pretty serious. You could receive an F. You could get dropped from the course. You could get dropped from the program. Okay, you could also be potentially dropped from Cabrillo College completely. So it's definitely not worth it. I know it can be tempting when you get overwhelmed. It can seem like it might be the easy way to go, but it's not going to help you at all in the long run. Remember, these courses are designed to help you pass a certifying exam to become a medical assistant, right? I don't believe there's any place around here that you can work without being certified. So that means either taking the national exam or a state exam. There's a couple national exams you can take, or the California state exam. And so those are rigorous exams. And this whole course is designed to prepare you for those. So if you cheat your way through, you're not going to be prepared to take the exam, and you're probably going to fail. And then you're not going to be able to get a job as a medical assistant. And so this whole program would be a waste of time, yours and ours. So that would be sad. So don't do it. Okay, it's your responsibility to drop the class if you choose to. Of course, if you drop the class, you'll have to try to repeat it if you want to continue in the program. And if this is a prerequisite for other classes in the program, so that could set you back a little bit. But just let us know if anything's going on. If you need to take a side step from the program, we can probably work that out. Okay. There's going to be homework assignments that will prepare you for the weekly exam. Okay. Late assignments and homework submissions will be subject to a penalty of 0.1% per day past the due date. So every day that it's late, you'll lose credit on that. Okay. There's going to be weekly exams. They have 30 multiple choice questions and 20 true-false questions. You will have 40 minutes to complete the exam once you begin it in Canvas. Okay, this is falling in line with the national exam standard, which consists of 4 modules. Each module has 50 questions, right, just like ours, and they have a time limit of 40 minutes. So this is designed to prepare you for that certifying exam again. No makeups unless you have a verifiable emergency or court order or with proof to prove why you were unable to take the exam I think you have a week to take it, right? So there really shouldn't be any reason for not taking it before it closes. Okay. We do drop the 2 lowest exam scores. So if you don't do well on 2 of the exams, then those will be dropped from your total. So it gives a little bit of leeway. I know life can get in the way sometimes, and sometimes you may not be able to study quite as much as you should, and that's going to be reflected on your exam score. So this gives you a little bit of leniency with that. However, if you're repeating the class, you must pass every quiz and test with a 75% or higher. So if this is your second time taking MA 125, you're going to have to step it up a little bit, right? Talk to me, talk to your other instructors if you need help figuring out a plan for how to do that, how to be successful in the course if you're repeating it. Okay. There's going to be one midterm and one final exam. They're each 100 multiple choice questions. We will provide you with a study guide before each exam so you'll know what to study. There's no makeups on those unless you have a verifiable good reason. Okay. The midterm and the final exam you have to score at least a 75% on those to pass the class. So you definitely want to study for those and prepare well for them. We're going to talk more later in a separate video about the Emergency Preparedness Project. Okay, so we'll skip this for now. We're going to have the lab competencies each Friday that we'll be performing, and these are in your study guide. They're arranged numerically by chapter. So you're going to want to arrive on Friday with those all ready to go. I would probably rip them out of the study guide because it is quite large and you probably don't want to bring the whole thing into class with you. So you'll know ahead of time which competencies we're performing on Friday. So you can bring them in with you. You're going to turn them in before you leave lab class. So you're going to complete them and turn them in for credit. You're going to staple them in numerical order from lowest to highest. And some of them require charting. So you're going to make sure that you've thoroughly completed the charting. Okay, so you're going to make sure you're going to have the date and time and proper strike through and sign off. We'll talk about that more. And then your charting content should be complete. And you're going to have a 1 point deducted for any misspelled words or if black ink is not used. And 2 points if the handwriting is illegible or if we didn't use the correct strike through and for correcting an error. So we'll talk about that more later as well. Somewhere around week 6, we're going to begin doing weekly vital signs on each other. So we'll be basically rooming a patient, obtaining and recording the chief complaint and full vital signs. And that's going to be turned in at the end of each lab class to receive full credit. We're going to hopefully do 2 each time, and they're each worth 10 points. So the sheet is 20 points total. Okay, you're going to have to make any of those up if you miss them. And you're going to make sure that it has the date and time, chief complaint with duration, proper vital sign charting format, medications and allergies, proper strike through and sign off, and again, the same point deductions as for the charting on the lab competencies. So we'll review these quite a bit more as we get closer to beginning them. So lab cleanup and dismissal. Each student is responsible for ensuring that their work area, the lab, the 3 exam rooms in the lab, and the classroom are clean before you leave, and that all equipment that you used is put away. Okay, if you don't do this, if you leave your area messy and not clean and not put away the equipment correctly, then you may not receive credit for the lab competencies performed that day. Okay, our lab rules are that we wash our hands before beginning every lab class. We're going to observe standard precautions, which we'll learn about soon. We're going to perform hand hygiene before and after gloving and before and after performing procedures. We're always going to wear gloves when processing specimens. Make sure we cover any open wounds, cuts, scrapes, even hangnails on our hands with bandages before gloving. Okay, we're not going to touch or use any lab equipment until we've been given proper instruction on using it. Okay. And usually you need to be observed by the instructor to get credit for performing the lab competency. So make sure you don't just go off and do it on your own. Again, no food or drink in the lab. You can bring a closed water bottle. Okay. If you need a break, you can take it. Just talk to your instructor. But again, you're not going to be in the lab for that long, so we should be able to keep the breaks to a minimum. Okay, we're never going to touch our contact lenses or rub our eyes during the lab or apply cosmetics. Pens and pencils should never be in your mouth. We're not going to wear long chains or necklaces, large or dangling earrings, or loose bracelets. Again, tying all our hair back. This is definitely a safety issue, as well as fingernails. Most facilities prohibit artificial nails, acrylics, or anything like that. And they often also have nail polish policies as well, that nail polish needs to be not chipped, and often they'll require that it's more of a neutral color. No children, no visitors, nobody can come into the lab with you ever at any time. And there's no exceptions to that. It's a huge safety issue. We talked about this earlier. No perfume, scented products, lotions, or scented hair products. This is really important, keeping noise to a minimum and using a low voice when working together in your group or taking vitals. As you'll see, it's very difficult to hear blood pressures when everyone is talking around you and making chit chat or idle conversation. Okay, so if anybody is having an issue with this, we'll definitely have to warn you and then possibly ask you to step out until you can, keep your conversations to a minimum. We're going to keep all our work areas organized and clear of any extra items, books, bags. We shouldn't need to bring too much into the lab with us. Just a mask, right? Maybe your car keys, and like I said, your cell phone if you're expecting something urgent. We'll arrange that, and a water bottle. Otherwise, we shouldn't need to bring anything with us. And you're not going to leave until you've been dismissed. Okay. So also underneath the syllabus is the course summary by due date. And the dates have been updated, it looks like, except for the week 0 wrap up. You should have the orientation module completed by this Sunday evening, which is the 30th of August, right? So that on Monday, August 31st, when Cabrillo semester officially begins, you can start on module 1. Okay, and then you'll have a week to complete module 1. So starting Monday morning and then ending Sunday evening. And then the next Monday, we'll start the next module. Okay, these look like they need a little bit of updating, so we'll make sure we do that. If you have any questions, please let us know. Okay, thank you.